Thank you for staying with us on the AM show. We start with our very first conversation, and we're going to be talking about HIV in Ghana. Per the current release from the Ghana AIDS Commission, there are a number of issues that have cropped up. We'd also be focusing on antiretroviral medication supply to those infected. We'll talk about general care as far as those living with HIV and the need for donations from corporate entities and individuals to support the Commission in its quest to achieve its objectives. We'll be looking at all of that this morning. And let me get to our guest joining the conversation in the studio with us this morning. We have Dr. Treme Echiahene, Director General, Ghana AIDS Commission. He joins us for this conversation. Doc, a very good morning to you.
Thank you, and good morning to you as well.
Now, the last time you came through, we had quite a conversation about where we stand as a country when it comes to HIV. I would like you to go back to reminding us of how far we've come, yes, but how much more we have to do, and that uptick in infections, especially concerning those who don't even know they have been infected. What does the picture look like?
Well, thank you once again. The total number of people estimated to have HIV in Ghana is about 355,000. And of this number, we have young people, in fact, from age 0 to whatever, age you may imagine. And so these people are the people we all see in this country. If you talk about every profession or social organization, every community, every region, every district, we have people living with HIV in all those places.
So it is basically widespread across the length and breadth of the country.
Yes. The data is quite clear. There is no single community in this country that doesn't have HIV. There is no social group in this country that doesn't have HIV. So if you talk about religion, yes, we have a number of people in the churches. In fact, more than 80% of people who live with HIV are churchgoers. And so there are, among the Muslims, if you talk about work, every workplace, every organization, you may find HIV person there. And so it's widespread. And why it is so is the fact that let me first talk about the fact that we have high numbers of new infections. In 2022, we had almost 16,600 people who got infected in 2022. That is concerning because that number is too high for the country. And it is so because we have a number of factors working against us. Although the efforts we have made, the investment we have made, brought about declining trends in the new infections. However, the level of decline is not significant enough to, get us to the targets that we've set for ourselves for 2025. And it is so because young people have been, and I believe the social media has contributed to this, which in my view, the social media has, if there is any word like misempowered young people, to the extent that many of them have become, quite liberated when it comes to sex. There is a particular video where a young lady was asked that, ladies believe that some guys are stingy. And the lady said, oh, no guy is stingy. He said, why? He said, well, if you open your ties, he will open his wallet. And she went ahead to say that if you don't invest in a closed bank, you don't invest in a closed bank, you invest in an open bank. So a guy will open his wallet when you open your ties. And if this is the mindset...
About how old will this person be?
19, 20, maximum 21. So I ask myself, if this is the mindset of young people, I can't use a case to generalize, but the evidence is quite clear that we have seen more and more young people going into prostitution. Prostitution has become so common in our country. You have young people at the age of, let's say, 10 in prostitution. Now people see their bodies as a source of income, that they can use their bodies, to raise income. Some have, desperate situations, so maybe it's for livelihood, but for most of them, it's for luxury. And that is very concerning.
I mean, we hear of young ladies who are doing all kinds of things for something as mundane as an iPhone or phones, gadgets, because it's a status symbol.
Even Indomie, even having a free ride on Pragya. No, media, they are going to highlight these things that I'm mentioning, but honestly, that shouldn't be the focus. It's happening everywhere in this country. And unfortunately for us, the sub-region, many people in the sub-region think that Ghana is more prosperous, it's a safe haven for them. So they move here. And some of them cannot find the jobs they anticipated to have. They go into prostitution. So you have so many people who are being trafficked into Ghana just for prostitution. Our students, both males and females, are involved in prostitution. And besides that, the mining activities in the country also contributing to the increasing numbers of new infections in the country. Besides that, we have a number of businesses that, use sex to sell their products. And all these are contributing in sustaining high numbers of new infections in the country. And we as a people have to decide whether we want to eliminate HIV or we want it to grow exponentially in the country. Why? Because we have all the tools and we are doing everything that gives us the opportunity to end AIDS and eliminate and achieve epidemic control of HIV in this country. But
why are we not getting there?
Yes, because these behaviors among the population is one of it. And of course, we also have financial challenge. As I have always said, we only have a third of the money we need for the AIDS response. And that third is coming from our donors. And our donors determine what the money should be used for. So about 64% of that money is going into procurement of HIV commodities like antiretroviral medicines, mainly antiretroviral medicines. Government is supposed to buy the test kits, the reagents, the condoms, and the others. In addition to complementing the contribution of donors in procuring antiretroviral medicines. And the rest of the donor money, the chunk of it is going into key population programs. And so there is very little to do prevention because if we can reduce new infections, then we should be able to reduce scale up prevention
and Doc,
activities.
that brings me to this. I mean, I remember way back when you had the ABCs and abstinence, being faithful, condom use. You remember the campaigns on TV and all of that, because that was what we had access to then. Now we have social media. Of course, there's the negative use of social media. Yeah. We've seen the twerking videos and young people doing all kinds of things, which allude to what you said, the negative side of social media. But can't we also capitalize on the positives of it to sell the message of the dangers inherent in those lifestyles? And because back then, people were much more cautious, especially in the 90s, 80s and 90s. The stigma was there when you had these. People had so many misconceptions. Those ads and things helped disabuse the minds of people. Are we tapping into those as well as the AIDS Commission?
Yes, we are. We have all the social media handles. The problem is the following. Yes, we do not have, my team I don't have, team with the skill to really boost the following of the commission on the.
Are you logistically constrained in that regard?
Severely challenged, and so we are hoping that we'll be able to bring on board somebody with the needed skills to really help us expand our reach on the social media. But of course, anyone who feels that they can help us in this area will be very happy to.
I just went on Instagram. I see Ghana AIDS Commission and then I see Ghana AIDS. Which one is you? I'm following you now.
Ghana AIDS Commission.
Okay. And I guess if all of us were to do that and spread the word, I'm sure it would help, matters. So I just followed the Ghana AIDS Commission. And when I see your posts, I will share them as well.
Thank you.
So moving from there, right before I get into the antiretroviral treatments, the ARTs and everything that is happening, what is the status? I've always been curious. What is the status of mother-to-child transmission as of now? Because these are supposed to prevent that, right? But I've also heard instances where the transmissions actually do occur. What's the status of that?
Mother-to-child transmission is an important component of the prevention program we have in the country. And every mother or pregnant woman is tested for HIV, syphilis, and hepatitis, of course, along with other diseases when they visit the ANC for the first time during their pregnancy term. And so we have about 87% of mothers living with HIV receiving antiretroviral treatment.
87%.
Yes.
Right.
Receiving antiretroviral medicines to prevent the mother-to-child transmission.
Okay. What happens with the remaining 13%?
Yes. So some of them do not. We are not able to cover them. Either they are unreachable or they are not willing.
They're not willing to take the ARTs.
Take the medicines. Of course, there are some challenges in that area as well. But with respect to the babies, we expect that mother-baby pair should be on treatment, and so that the baby, if it has HIV, can also, grow and mature and live normal life like everyone else. With the help of antiretroviral medicines. Right. But we need to confirm the HIV status of that baby. We do antibody tests, but we have to also have the PCR test to actually determine whether the antibodies are not from the mother. Okay. Or due to his own immune, mechanisms. And so we need to know for a fact that the baby has HIV before is given antiretroviral medicine. But they are often given prophylaxis until PCR test results have been released. But the challenge there is that the coverage is very low. The coverage is very low. It's about 40%. And so majority of the children don't get the benefit of knowing their HIV status as early as possible, and if they are positive, being put on treatment. But that problem is being currently resolved, but it has to be as rapid as possible, because Ghana in 2012 was seen in the whole world to be the first African country to eliminate mother-to-child
We were right on that path.
We were right, and we still are right, because you have more than 95%, between 95 and 98% of pregnant women visiting ANCs. So with that high, almost universal, coverage of ANC, we should be able to
eradicate
mother-to-child transmission. But unfortunately, the problem of equipment is the main reason. There is a stopgap measure where the samples are taken and to places where we have facilities where we have the test machines, the PCR machines, to test and get the results back to the mothers. But there are here too a few challenges, but hopefully by next year we're going to get more point of care machines that will enable more and more babies to be tested, in health facilities near them.
Let me just, and we're hoping as we do this, we're hoping that those multinational corporations, those big corp entities will also, come to the aid of the Ghana AIDS Commission. The Ghana AIDS Commission needs aid, logistically, funding-wise, in many ways, and that is how we can also help. Let's not always make it that big corp is going in a certain direction. How about channeling some of your resources in there for them, for the health of the nation? A healthy population, obviously, will be able to work and give you the money that you, big corp, you need. Daniel in Sefo says, may you get the needed funds for the good work you are doing. People appreciating your work, Doc. But this one, Gabago Franklin Rex says, the major problem of the testing regime is the health providers. In the current dispensation, before you get home after testing, your result is waiting for you at home and in your community. People, in fear of the stigma, decide not to test. Is this a real problem? Is this real?
I don't understand what he means by your results is waiting for you.
So you've gone for the test, which is supposed to be private.
Yes.
Before you get home, before you get to your community,
somebody...
They say.
That's,
stigma.
That's very unfortunate if that is true. We know of, a few incidents of this nature, but my advice to our healthcare professionals is that it's against the law to disclose somebody's HIV status to a third party without his or her consent.
I mean, anything medical, even
yes.
medical, anything medical, even staying away from the seriousness of HIV, anything medical. You have no right to share that information.
I'm happy you are mentioning this because it's an ethical issue. And as a practitioner, as a healthcare practitioner, your reputation goes with everything you do. And so if you unethically handle situations of this nature, then it is not good. And the Ghana Health Service has a patient charter. And in the patient charter, we've ensured that these matters are fully addressed. And so if they go against these rules, then we expect the Ghana Health Service to, take the necessary action and ensure that such people are sanctioned. But I just want to assure Ghanaians that the Ghana AIDS Commissions Act 2016, that is Act 938, clearly states that nobody should disclose your HIV status to a third party without your consent. And if that happens to you, you reserve the right to to have redress, and you can do so legally. And the commission will stand with you and work with you all through the process, all through the legal process.
Let's talk about, we've spoken about some of the specific matters, but in terms of general care of those living with HIV in Ghana, assume someone learns today that he or she has been infected. What happens from there as far as the Ghana Health Service, the Ghana AIDS Commission is concerned? What happens from there?
So the policy we operate now since 2016 is test and treat. Now, HIV is handled like we do for malaria. When you have the malaria parasite in your blood, then you must be given anti-malaria drugs right away. It's the same way that HIV is being handled. So you test, once the test results is confirmed that indeed you are HIV positive, they will offer you the antiretroviral treatment right away. And within, even if it must delay, it mustn't go beyond 1 week.
Wow.
Yes, it mustn't go beyond 1 week, so that the person, because the drug is the only medicine that can suppress the virus first, keep the person alive and productive. And so we leave no chance.
Speaking of which, you remind me of Magic Johnson.
Yes.
I always look at him and I'm like, wow. You know, some people feel getting HIV is a death sentence. Actually, if you take proper care of yourself, this gentleman, since was it the 80s? And
yes.
he continued with his career up to a point.
Yes.
And you see him today, and if no one told you he had it, he wouldn't know.
And yes, that's right. And we have so many people in Ghana who has been on treatment for 20 years, 21 years. And they are alive, they are strong, they are working, they are living normal lives. If you don't know they have HIV, I mean, nothing show. I mean, you would think that they are one of the healthiest people in the community.
Which is why stigmatizing them is so wrong.
Yes, it's so wrong. And so antiretroviral medicine is the only way you can keep yourself alive, healthy, productive, and even reproductive, where your baby too will not have HIV, will be HIV negative. And so we encourage everyone who is on antiretroviral treatment to adhere to treatment, and if they are virally suppressed, maintain their viral suppressed status by adhering to treatment. That is the only way that if you are a woman and you want to have HIV-free baby, you can have it. Because when you are virally suppressed, the possibility of passing the virus to your unborn baby or during delivery or breastfeeding will be quite negligible. And so you need to remain on treatment.
Let's look at these little bits, not little so to speak, but final bits to conclude the conversation. The ARTs are free.
Yes. Everything about HIV services are free. All HIV services are free.
And I intentionally bring that up because some people may also think, oh, and I'm now going to, the ARTs are free. I think it's same with, is it tuberculosis or something of the sort?
Yeah,
it may
tuberculosis are also free.
Uh-huh.
The services for tuberculosis patients are free, yes.
Right. So let's create that awareness. It is free. If you find that you are infected, the state is willing to, and that's why so much in terms of funds.
It's free, but let me
pumped into this. But there are other aspects that you have to look at.
Let me throw in this. It is free, but how they get to the facility to collect the medicine?
Oh yes.
Cost them in terms of transportation. And unfortunately, because of stigma, many people travel for far distances to collect their medicines. When we have more than almost 600 health facilities across the country where people can receive, it's nearby, it's quite close to them. Every district hospital, we have some polyclinics, we have health centers. Even now, the arrangement is being made for them to receive it at the CHIP compound. And so why would you travel and incur cost? But I need to indicate that because of delays in reimbursing service providers by the National Health Insurance Authority, some facilities have decided to charge people living with HIV for some of the services.
Wow.
For example,
that is happening?
Yes. For example, lab services, laboratory services. And that is costing them a lot. Out-of-pocket payment relating to HIV treatment by persons living with HIV in Ghana cost them out-of-pocket payment was in 2019 was almost 22 million.
2,200 Ghana cedis.
No, $22 million.
Oh, wow.
Yes. In 2020, it increased to $28 million. In 2021, it went up to $32 million. Now,
wow.
This is very worrying because it's supposed to be free. But because we do not have the money, we have huge funding gap of about $89 million a year. These people are being made to pay for the services that they are supposed to receive for free. And so that is the more reason why we need to bridge the funding gap. Why? Somebody will say that, but why? We all go to hospital and we pay.
Right.
So why should persons living with HIV be treated differently? Yes, they have to be treated differently because HIV is not exactly like every other disease.
Right.
We're
all at risk.
Yes.
Once they are at risk, we are at risk.
We are at risk. If they do not have the medicines, it means the viral load is going to increase and they will become more infectious. New infections will therefore increase. They will become sick, develop AIDS, and die. And
to talk of the burden on our hospital facilities.
Exactly. At some point, more than 40% of hospital beds were occupied by HIV patients. We don't want to get there. Now, the other reason is that when they do not have the money to pay or go and take their medicines, what happens is that some of them discontinue treatment. They discontinue. So we have high number of what we call loss to follow-up. People were on treatment but can no longer be traced within 3 months or more. And that number is more than 30% of the people who are on treatment.
Currently?
Yes.
More than 30%?
Yes. And so that is very worrying because if they are not adhering to treatment, what will happen is that it's not only the viral load that is going to increase or having disease progression, it is also possible they will develop resistance to the drugs that we have. And so if they are on first-line drugs and they develop resistance for first-line drugs, we will need to move them to second line, which is more costly, which is more expensive than the first-line drugs. And as a country, we know the fiscal challenges we are having now, and we have to be efficient in managing the response. And therefore, we need to cut out these issues to ensure that people living with HIV can continuously receive their medicines and adhere to treatment so that they remain virally suppressed and prevent disease progression and escalation in new infections.
Okay, let me just bring in these bits to wrap the conversation. But before I get to the final bits, I just want you to tell us about how to assist those we know in our communities that have HIV or AIDS. And I pose this question because of one, the stigma, and sometimes help people could give that they don't, because there are some misconceptions about our brothers and sisters living with AIDS. How more can we assist them so that they attain their full potential even with this situation?
Yes. HIV, people living with HIV can live normal lives like everyone else if they are on treatment. But sometimes some of them wait for too long doing, healing shopping. They often will go to herbalists and spiritualists, and by the time they get to know their status, it's too late. And sometimes too, the policy is that every person walking into any health facility must be offered testing, HIV testing. But this is not done. And even during the consultation, some of the doctors do not even consider HIV. And so by the time some of them get to know their HIV status, it's too late for them. But of course, if they are put on treatment immediately, they recover and live normal lives. And so what we are saying is that they need help. Some of them, especially the children who have been orphaned by AIDS, some of them they don't have carers or somebody looking after them. Such people need help. And as I was saying, some of them travel far to receive their antiretroviral medicines. And sometimes they don't even have the money to go because they may have spent their life saving on, battling the disease before they get to know. So they are often poor and they need help. And one thing that they need most is food. Okay. Because good nutrition is very important for the management of HIV-related diseases. And so nutrition is a number one priority that I would want all Ghanaians to consider for people living with HIV. And some do not have, livelihood. They don't have any jobs. And so we have to help them stand or live to be financially independent by helping them engage in some economic activities. But these are some of the things the Commission does for them when we have funding. Because now you have a number of young people who live with HIV. Some are out of school and they have no jobs. And so if they are supported in any income generation or learn trade, it will at least give them a better future.
So we can all find ways and means of lending a helping hand.
Exactly.
And in a way, lending a helping hand to ourselves.
Yes.
Because as we help them, we help ourselves.
But the interesting thing is that people always stigmatize those they know live with HIV. But there may be some people who are so close to us that we love so much and we don't know. Because the people who live with HIV are just like any one of us.
Just like the rest of us.
Yes. So some are well-to-do, some are poor, some are in, high positions. But the point is, you don't need to know. He's a human being.
Exactly.
He's a friend, he's a brother, he's an uncle, he's a father, he's a mother. That is what is most important.
It reminds me of an image I saw once where, in a war-torn community, they were asking a child, are you Christian, Muslim, Jew? And the child said, I am hungry. That was the...
Yes.
It's not my religion.
Yes.
The child was being... I don't understand. I'm hungry. That's the language I understand. To cap off the conversation, though, I have reached out, but I want you to reach out to those entities, big corp, small corp, that can assist you. I mean, if all of us do our ntobwa and we help the cause, things will get better logistically. What do you think, though, about the COVID-19 kitty? Because some have said that, look, we're still paying the COVID-19 levy. Yesterday I went somewhere, COVID-19, we're paying, but the pandemic has passed. Are you looking forward to seeing some of that channeled to you? Is that one of the practical means of getting support to you?
Yes, there is an advocacy to repurpose the COVID-19 recovery levy. And the governing board of the commission met just last week and came up with a resolution. And one of the points in that resolution is that COVID-19 recovery levy should be repurposed for HIV.
Okay.
And so it is something that we need the voices of well-meaning Ghanaians.
You support it?
To support it.
Do you support it?
Yes, 100%, because we have National HIV and AIDS Fund set up by law in 2016, and the fund has not been resourced. And looking at the huge funding gap of 67%, what else can we ask for? We need government to come up with, source of funding, which is dedicated, because the fund, according to the law, has no dedicated source. It only has to rely on budgetary allocations every year by Minister for Finance. But so far, that has not been done. And so we need dedicated source. And when we're talking about HIV, it's an incurable infectious disease. So it's going to be with us for a very long time, because antiretroviral medicines making people live normal lives and have, their normal life expectancy. So now we are talking about aging with HIV. And aging with HIV means it's not HIV related conditions that kill those who are aging. It is rather non-communicable diseases. So there are a whole lot of issues about HIV, and we should never forget that HIV is disproportionately affecting the most economically active population in this country. So if we ignore HIV by way of denying it the needed funds, we are actually putting our economy and our national development as a whole at a very serious risk. And so it is important that corporate Ghana and individuals support. And we are making arrangement before next month is going to be World AIDS Day month, awareness month. Now this month is for cancer. Next month, November, is for HIV. Yeah. And so we are going to have series of activities within November. And during that time, we will want to have the National HIV and AIDS Fund launched. And that is the time that we will want the president to receive donations from corporate bodies and individuals who want to present their checks to the president as their contribution to the AIDS Fund. For the individuals, it's easier to do it, by the USSD code. You just dial star 9898 hash and follow the prompt.
Can you slow down on that?
Yes.
So
star 9898 hash. Follow the prompts, and you can do it on MTN and Vodafone. We are working to bring on board Tigo as well, Airtel Tigo as well. And so dial star 9898 hash, follow the prompts on MTN and Vodafone, and do your donation. So far, a number of people have attempted to do that. We don't know why they don't end up, majority of them did not end up donating. But the few who did, and we have more, just about 100 people or more, donating an average of 20 Ghana cedis. We are very grateful to those people. We thank you very much for your donation. We say no amount is too small. If we have 3 million people donating 20 cedis, every month, that is going to help a lot. And so we encourage everybody to donate. My staff came up with they said charity begins at home. And so if we are asking the public to donate to the AIDS Fund, then we must start it. So they said that junior staff should pay 20 cedis a month. Managers should pay 50 cedis a month. Directors 100 cedis, and Director General 150 Ghana cedis a month. I didn't participate in that conversation because, so when I was told, I was really impressed. And this is an idea that came from NPA. They said, okay,
National
Petroleum Authority.
Right.
I'm happy to mention their name. They said, well, we will get our staff to, contribute monthly, and the company will also match up what the staff contribute. And so let's all see HIV as a workplace issue, as an industrial issue, as a commercial issue, because the people who work in these places are the most economically active population who are disproportionately affected by HIV. And so if you want to reduce, absenteeism resulting from illnesses associated with HIV or any other infectious disease, you have to join hands with the Ghana AIDS Commission,
right,
to prevent this. Fortunately, the services, all HIV services, are for free. So we are treating your employees for free so that they can continue to serve you, they can continue to work for you, produce for you, to make profit. So it's important you also contribute to the AIDS Fund.
Thank you so much, Doc. So on social media, Ghana AIDS Commission, is it across the board? Ghana AIDS Commission.
Yes.
Instagram, I followed you. Where else? Are you on Facebook?
So, yeah, Facebook, YouTube, and I think Twitter.
X, okay. Yeah. Now X.
Okay.
And Instagram, because I saw you.
Yes, and Instagram as well.
So all across social media, you can find the Ghana AIDS Commission. Let us, a little, like he said, if even all of us were donating 20 cedis, it may not be 20 cedis you can donate, but if even 3 million people were donating that, that's just about what, 60 million?
I think
3 million people by, or is it 6 million?
I think so.
Whichever the case may be, that would be a lot of money that would be able to, assist the Ghana AIDS Commission in its work. And together, we can all do it. Thank you so much, Dr. Treme Etiahene. He is Director General, Ghana AIDS Commission, and he joined us in the studio on this all-important conversation. Stay with us on the AM show. There's a lot more that we'll be bringing your way shortly. There's still that conversation going on when it comes to the Akosombo Dam. We'll just take a sneak peek at that as the Vice President also gets there, among other things, other discussions we'll have this morning. Of course, National Science and Math quiz also in the offing. So stay, we'll be right back.